Virus progression by Asim, Caleb, and Braden.
So the way this experiment worked was that there were 9 patients issued to the hospital, and they were each showing similar symptoms, showing that a similar virus was affecting each of the patients. And the virus in each of them was attacking T4 cells, which are important to the body's immune system, so that they can fight off harmful viruses or other things that are harmful to the human body. And these occurred in different latency periods or just different times when the virus would attack. And these patients tended to die when their T4 cells fell below 10% capacity because their body was no longer to fight off other things that were harmful to them. Our first data table is looking at the length of latency period for each attack cycle for each patient. And the reason we wanted to look at the data like this is because it shows the correlation of length of each latency period and the amount of attack cycles that the patient was able to survive. And we wanted to look at it this way because this is also a good indicator as to how progressive the virus could be.
Process data table. A process data table is the average latency period in months per infection cycle for each of the 9 patients. Using the data from Table 1, the average latency period between each infection cycle was calculated, and patient 1 was used as our control variable for the t-test. Each p-value for the t-test was greater than 0.05, meaning that the data from each patient were statistically similar. This shows that the latency period for each patient and the amount of latency periods was statistically similar and pretty close to each other.
Virus progression by Asim, Caleb, and Braden. So for our graph, it's measuring the average latency period in months per cycle for 9 patients. And as shown previously in Table 2, this is displaying the time between attacks by the virus. Also shown in our graph, you can see that the error bars are very large due to how the data varies between each patient.
Findings. By displaying the data as the average latency period between each viral attack for each patient, the doctors will be able to better time the treatment. They would have a better understanding of when the virus is most likely to attack, and they would be able to time its cycle. This timing could help keep the virus suppressed and prevent a relapse. This preventive approach dealing with the virus makes treatment more effective and the symptoms less severe. Doctors can predict when an attack is likely to occur and proactively start treatment to minimize damage to the patient and the symptoms they experience. Scientists will be able to also study the progression of the virus to see how long the patient has to live and to come up with better treatments and maybe even a cure.